Thank you for joining us here today. At the outset, can I thank all our firefighters, emergency services workers and all the volunteers for their incredible efforts over an amazingly challenging weekend. With 4 major bushfires across Bruce Rock and Corrigan, Bridgetown, Denmark and Cabally. Minister Dawson and Commissioner Clem gave an update from Denmark just a short while ago. These were some of the most ferocious bushfires we've seen in Western Australia. Our firefighters have done a tremendous job to minimise the damage. Our thoughts are with all of the people who have lost homes and businesses. My government stands ready to support the communities impacted by these fires. Now to an update on the state's evolving Omicron situation. To 8 p.m. last night, Western Australia recorded 26 local cases. 24 are linked to close contacts of known cases. Some of the new local cases were infectious in the community. In addition, there were 9 cases related to interstate travel and 1 related to international travel. That brings the total number of Western Australia's active cases to 265. 8,007 people were swabbed at WA clinics yesterday, which is a good result. With regards to our amended border settings, which came into effect on Saturday, over 12,000 people arrived back in Western Australia over the weekend. 10,406 by air, 1,788 by road. Over 3,000 are due back today, with 23 domestic flights arriving. These people are subject to strict quarantine conditions and testing requirements, including the use of the G2G Now app that requires them to show their whereabouts, and the requirement for anyone else at the place where they are isolating to isolate as well. It is clear we now have a higher level of community spread in Western Australia, something we have been able to hold off since the start of the backpacker outbreak before Christmas and since the start of the pandemic 2 years ago. We now have 265 active cases in Western Australia, and we can expect daily case numbers to continue to rise over coming days. It is also worth remembering that with thousands of recent arrivals now in self-quarantine, it is likely the virus could leak out and spread into the community further. As a result, our high caseload settings detailed last month will now be introduced. Public health measures, strong contact tracing systems and strict test and isolation rules have served WA incredibly well for the past 2 years. It's important to remember, not only did we successfully crush the Delta backpacker outbreak in January, we've managed to keep this current Omicron outbreak under control for an extended period of time. The index case essentially caught it when they picked up a returning Western Australian from the airport on January 2. That is effectively 5 weeks of keeping the outbreak at low caseloads, despite some very challenging contact tracing scenarios, including massage businesses and nightclubs. But with the rising case numbers, further unlinked cases and the added risk of high numbers in self-quarantine, our policy settings now need to shift. Based on the latest health advice, considering the high level of Omicron in the community and the number of cases in self-quarantine, effective tomorrow, we'll be moving to our higher caseload testing and isolation guidelines. These new protocols are not a sign that the pandemic is over. They signify the start of the real impact of Omicron in Western Australia and will help manage community transmission and minimise disruption caused by the virus in the community and economy. These new protocols, which we announced in January, will be introduced across the state from tomorrow. Under our high caseload settings we previously announced, the following will now be implemented. Beginning tomorrow, the new close contact definition will be a household member or intimate partner of a person with COVID-19 who has had contact with them during their infectious period, or someone who has had a close personal interaction with a positive case during their infectious period, for example, had at least 15 minutes of face-to-face contact where a mask was not worn by either person, or having spent more than 2 hours within a small room with a case during their infectious period where masks have been removed by either person, or, and in addition, a close contact is also someone who has been notified by WA Health that they are a close contact based on specific circumstances. As I outlined last month, under these new high caseload settings, we will no longer have rules for casual contacts. However, if you have been to an exposure site, you should always monitor for symptoms. This definition is broadly aligned with what was agreed at National Cabinet. New testing and isolation guidelines for positive cases and close contacts will come into effect, with isolation reduced to 7 days and testing rules depending on your circumstances. I won't go through all of them again now, but full details can be found online. High caseload settings will also be in place for schools and childcare centres. This means a specific definition of a close contact will be in place for schools and childcare centres to keep schools functioning safely and ensure our students continue to get the best education possible. The definition of close contact with a positive case in a school or childcare setting is face-to-face contact for 15 minutes or more with an infectious person where a mask was not worn by the exposed person or the person with COVID-19. Or interaction for more than 2 hours in a small indoor space, or interaction for more than 2 hours in a classroom environment with an infectious person where a mask was not worn by the exposed person or the person with COVID-19, or someone who is directed by WA Health that they are a close contact. Additional measures will be implemented to minimise the risk of COVID-19 entering or being transmitted on school grounds, including prohibiting indoor face-to-face events, cancelling or postponing school camps, cohorting to limit mingling of groups, and modification to timetables, break times, and pick-up and drop-off times where practicable. It's to ensure that schools can remain open and remain open safely. Tomorrow will also mark the beginning of wider use of rapid antigen tests, or RATs, for diagnoses. But it's worth noting our PCR testing facilities have a capacity for 35,000 tests per day, and PCR remains the most preferred test. However, RAT tests are being distributed to our public testing clinics to enable them to help manage demand and wait times. Today, we're also launching a system by which rapid antigen test results can be logged with the government. The Health Minister will detail the system shortly. But I want to stress, if you return a positive RAT test, you must report it to the government. Reporting a positive result is mandatory. We need to have line of sight of the virus in the community, so we are relying on everyone to do the right thing for your sake and for the sake of everyone else. With the commencement of new isolation rules for positive cases and close contacts, we'll also be making changes for travellers into WA. Firstly, with the new high caseload settings from Wednesday, the quarantine period for both approved international and interstate travellers will be reduced to 7 days. In addition, as part of the new protocols taking effect, our international arrivals cap will be doubled, up from 265 per week to 530. Vaccinated direct international travellers will be permitted to self-quarantine at a suitable premise if they're eligible. Now, under the hard border settings, approved travellers will be required to take a PCR or RAT test on day 1 and then return a negative RAT on day 7 to end their self-quarantine period. Any travellers, positive cases or close contacts currently in self-quarantine under the previous settings, including those that arrived over the weekend, will be able to leave quarantine once they've completed 7 days and followed other specific protocols directed by WA Health, including testing. In other words, if they or someone in their household tests positive, they'll need to follow the appropriate rules. But otherwise, they can rejoin the community after 7 days. Unvaccinated direct international arrivals will still need to go into hotel quarantine for 14 days. As I've said, there will be more and more cases in the community and isolating at home whilst they wait for symptoms to pass. For many people, especially those who are triple dose vaccinated, it will be a minor illness. Others will experience more obvious symptoms with higher risk factors, especially if unvaccinated. They can register for WA COVID Care at Home, which is a free monitoring service for positive cases. Details can be found on the Healthy WA website or by calling 13 COVID. Visit the hospital only if your symptoms worsen, which may include chest pains, difficulty breathing and feeling faint, and follow the instructions for where to go. Western Australia is about to embark on its most challenging phase of the pandemic. For 2 years, WA has avoided the worst. Our safe and cautious approach throughout the pandemic has helped put WA in the best possible position to manage COVID-19 safely. No community transmission for long periods of time meant that things were pretty simple. The road ahead is about to get very bumpy. The state is going to embark on a difficult period. We're going to get more cases and we're going to get them sooner. Just to illustrate, the day we announced these settings last month, we recorded 9 new local cases. Today, we recorded 26. However, by comparison, the day New South Wales brought in these kinds of rules, it recorded many thousands of daily cases. Opening ourselves up to more risks does mean the virus will spread faster. Given our low case numbers for so long, it may shock some people, but it's necessary to keep the community moving. Western Australians should take higher caseloads seriously, but it's not a cause for panic, not at all. We're prepared for this. Keep up your activities, keep going to work, support your local businesses, but be sensible and be safe. If you're sick, stay home and get tested. Check in at venues and check the exposure sites. Wear your mask. And if you haven't already, get your 3rd vaccination dose. Today is the first day of our 2-week vaccination blitz. There's even more opportunity to get your 3rd dose to ensure you have the best protection against Omicron. If we do the right things by each other, we can save lives, we can save jobs, we can minimise disruption. I'm determined not to make the mistakes that other states and other countries have made. I'm resolute that we will stay the course, because now more than ever, we're in this together. The Health Minister will now provide you with some more information.
Thank you, Premier, and thanks everyone for joining us here today. As the Premier has just announced, in line with the health advice, for high caseload settings and the new protocols for close contacts, we will be moving to use rapid antigen tests alongside our current PCR testing. Rapid antigen tests provide a quick result and are useful in a high caseload environment. Our state-run clinics will have a supply of rats that they can use when it is not possible to administer a PCR test because demand is too high. Our clinics will also provide rats to be used later in the isolation period or at day 7 ahead of coming out of self-isolation. In line with national advice, rapid antigen tests are safe for children to use over 2 years. And children aged 12 to 17 can perform the test themselves with a parent or guardian supervising. WA Health has set up a new system for positive rapid antigen tests to be registered. People who have taken a rat at home and have tested positive must register their result online with the Department of Health at the Healthy WA website. The mandatory registration requires information to be logged, including the date and time of the test, details about your situation, and a phone number for you to be contacted on. People who do not have access to the online registration system will be able to report their positive rat test via the 13 COVID line. WA COVID Care at Home patients will also be required to register their rapid antigen test as part of their program. This is a new phase in the pandemic. The number of cases in our community will continue to grow now that the Omicron variant is here. Our public health and safety measures that have kept us safe since the start of the pandemic remain as important as ever. We are relying even more on West Australians to do the right thing. If you take a rat at home and you return a positive result, you must register this with WA Health. This will be a requirement by law. We are still urging West Australians to keep using our PCR clinic tests as a priority. However, all state-run testing clinics have rats to use if demand for PCR reaches a peak. Rats are now readily available for purchase in-store. So if you buy a rat and take a test and record a positive rat result, you are still required to upload and register that result on healthywa.com. Rapid antigen tests will now be used to screen for COVID-19 in the Perth Southwest emergency departments. These new measures are an additional way hospital staff can screen patients who have symptoms or who have been to a known exposure location. And this will provide greater protection for patients and staff as they can identify those patients that need COVID-19 precautions before entering the ED. With the additional cases we're now seeing daily, I cannot stress enough how important it is to get tested. Testing remains crucial to slowing the spread of the virus and protecting the vulnerable in our community. We have seen what happens when this virus takes off in high-risk settings. In Brisbane, 15 residents of a single aged care home have now died following an outbreak at that facility. We do not want to see a situation like that here. So I would urge all West Australians, for the sake of others in our community, to do the right thing. Get vaccinated, including your third dose when you are due. We've made available an additional 40,000 appointments over the next 2 weeks for the third dose vaccination. Check the exposure sites regularly and present for testing. Continue to use Service WA or Safe WA apps. Wear a mask wear a mask at indoor public venues. And if you are feeling unwell or have been to an exposure site, get tested. It is the responsibility of all of us to protect those most vulnerable in our community. As I've said before, you might not become seriously unwell from this virus, but others, including someone you love, could. Yesterday, we undertook more than 8,000 tests across private and public testing sites. This is encouraging, but we must get these numbers up. WA has worked hard to minimise the spread of the virus, but it is important to get tested immediately if you are experiencing symptoms. And as I've said, we're now entering a new phase in the pandemic. I'm sure Western Australians will continue to do the right thing and play their part in minimising the spread of Omicron. And I'll now hand over to the Premier for questions.
Thanks very much, Minister. Any questions?
Have you backed down? Because you talked last week about it needing to be a complicated formula in terms of very high caseload figures. I mean, we haven't had very high caseload figures at all.
We've done exactly what we said we'd do. We said we'd wait till we got to higher numbers and we'd take health advice. So we received health advice today that this is the correct course. So we've done exactly what we said we'd do.
But we've only got, so last Thursday there were 12 cases. And then the daily cases after that were 13, 17, 19, 18, 25, 31, and now back to 26, which hardly gives the impression of high case numbers.
So the day on which we announced it was 9 cases, it's now 26, so it's a 150% increase. On top of that, we had the number of people come in over the weekend. So there's 10,000 people come through the airport, another 2,000 across the road border. Whilst those people are required to quarantine, they're going to be monitored by G2G pass, they'll have testing requirements and the like on them. We do expect that there will be some leakage out of that. So all those factors combined mean we've made the decision we've made. The reason we stayed with the older system was it was the right system for those days, but Omicron and the virus moves quickly. And so we've moved to the new system now.
You sure it had nothing to do with the CME coming out on Monday saying you've got to go to 7, then the Confederation of Industry, the AMA, education sector?
Absolutely, absolutely. One thing I've learned over COVID is you don't give in to people yelling at you. And we've remained strong on many things, and by remaining strong over the COVID period, and I've been through hundreds of press conferences in which people have been yelling at me to do things, and we withstood them, and therefore we saved hundreds of lives in Western Australia. So doing the right thing by the state and standing firm and making sure you make the right decisions based upon health advice has saved hundreds of lives, preserved thousands of jobs, kept Western Australia in the good position we're in. But the reality is now, with COVID spreading and Omicron spreading in Western Australia, most transmissible variant, is the road ahead is about to get very difficult. And so for many ways, the worst is still to come, and we are at the start of the pandemic now. The last 2 years, of course, we've used effectively to get our vaccination rate up, to get more hospital beds online, to get first, second, third doses, to get children vaccinated, to get the public prepared, to get all the protocols ready. Every other thing we've done over the course of the last 2 years has been to get ready for this point, because we haven't effectively had spread of the virus in Western Australia for 2 years. So now we're heading into a more difficult environment, but the good thing is, with our vaccination levels, we'll be better prepared than any other part of Australia for this point.
The Prime Minister has announced from February 21 the international borders come down completely in terms of double vaccinated people. Where are you at in that sort of thinking at the moment in terms of our border, without exemptions?
Well, international borders. So that means, according to what I heard him say, is international tourists can come in, but they will still be within our cap. So in the West Australian context, it's 530 people. I wrote to the Prime Minister today to ask for a doubling of our cap. The 530 person cap will remain in place for the foreseeable future here in Western Australia. At some point in time, it'll change. We can't apply the exemption criteria we use on an interstate basis to international arrivals, but what we do is we have the international cap. So that'll help constrain the spread. As I've said to you many times before, if we just open the border, interstate or international, it would just result in thousands of cases seeding in Western Australia and result in many deaths whilst we get the third dose vaccination rate up. I don't think many of you are at my press conference on Saturday, so I'll repeat what I said there. The Queensland Chief Health Officer, on I think it was Friday, Queensland had 21 deaths. I think yesterday it had 19 deaths. That's a lot of people. And on the deaths in Queensland on Friday, 2 of the 21 had their third dose, and he was very clear that by getting the third dose levels up, you're going to save lives. So what we're doing with getting the third dose levels up while we don't see thousands of cases is going to save many lives. Now, we do have the compassionate exemptions from over east. I know thousands of people have taken advantage of that, but they are required to quarantine and they are required to be tested, and they will be monitored by the G2G system, so we keep ourselves as safe as possible.
So to be clear, there's no date yet set for opening interstate borders completely, and it sounds like from what you've just said, the international border might open at a later date to the interstate border. We will have a cap in place.
No, I didn't say any of that. We haven't made any of those decisions. But the reality is that if we were just to open the interstate border without restriction, lots of people would die. And so what I'm trying to do is save West Australian lives whilst at the same time save West Australian jobs. Now, I know that is something that some people don't like, but all I'm trying to do is save jobs and lives at the same time.
When are we expected to hit that 90% target? The number of people who are boosted, it's going up 1-2% each day?
Yeah, it is. Our booster rate is going up terrifically well. So this is going to be a great thing for saving lives in Western Australia. I encourage people to continue to do it. I don't have an exact date on when we'll hit 80 or 90% at this point.
And there's no new restrictions coming in as part of a high caseload environment? And if not, why not, if the goal is to suppress the spread of the virus until we get
PHSM, so public health social measures, we'll make a decision on that. We monitor it every single day. We already have some, just so you know, you're all wearing masks. We wear masks around the place. We have them in a range of regions. We have the vaccination requirements on people going into certain venues. Further public health social measures will come into effect when we get health advice to do so.
Do you expect that won't be far off given how it's...
I don't have an exact answer.
Is there
with the international cap going up to 530, and WA not really having much of a say on who comes in, I mean, do you have a preference that it's going to be returning Australians if we get to a situation where tourists are allowed in, or do you just think tourists just won't want to come in because obviously they have to quarantine to come through WA?
I would have thought it would be returning Australians. So some people have gone overseas, as you know, throughout the entire pandemic and want to come back. Under the new arrangement, they'll be able to quarantine at home and do 7 days. So there'd be no advantage in coming in via Sydney and then coming back across. So we expect that there'll be some returning Australians as part of that. Just bear in mind, if they are unvaccinated, they have to quarantine for 14 days in a hotel.
Just on the rat kits, it's mandatory to report a positive rat finding. Is there a fine associated with that? And also, it's very hard to prove someone didn't report a positive finding.
Well, it is. Although the police have been very good at, you might have noticed over the course of the last 2 years, they've been very good at catching people who flout the rules. But there is a fine. From memory, it's up to $50,000. So there's a potential fine and other penalties as well. So look, we rely upon people to do the right thing. So when we move, we're going to have both the PCR testing regime and the rat testing regime running concurrently. But rats will increasingly take over, because when you get to higher caseloads, very high caseloads, the PCR system can't keep up, and so people will increasingly use rats. But at this point in time, we are encouraging people to use PCR tests because they are more accurate, and they do provide us with a read on who's positive, so we know where we're going and what other steps we need to put in place. So we're encouraging people to use PCRs at the moment. We have a capacity of 35,000 a day across Western Australia, but over time rat tests will become more prevalent, and we require people to register a positive result, and there'll be you use the portal in which to do that.
With their casual contacts sort of out the window, does the check-in system become redundant?
Not yet, not yet. So because it might be you might be a close contact at the venue. So no, we're not doing that yet. So I know Queensland has done that at this point in time, but you know, what did Queensland have? I've got the figures here. You know, today, in terms of new cases, Queensland had 4,701 new cases today. It had 19 people die. New South Wales has 7,400 new cases today out of 1.144 million cases they've had. We so far have had 1,748 cases. We had a net 36 new cases today. So we'll persist with those systems at this point in time.
Do you think the change in the isolation settings will encourage more people to come forward for testing? Like they won't have to quarantine for 2 weeks?
Yeah, I hope so. I hope so. So we'd hope that people will get tested if they're at exposure sites, if they're unwell, if they're showing symptoms, and encourage people to do the right thing.
So is it just not going to be feasible to continue with what we had now in terms of the contact tracing system? I think the other week we'd only used up to not even quite 200 of the contact tracers, even though the surge capacity of 800. So at what point were they just going to become overwhelmed if we're saying there's a high caseload? Or is there an increase of the mystery cases?
Eventually it does, but at this point it's not.
At this point.
It's not at this point. So we had 36 cases today. We've had a total of 1,748 cases over the last 2 years, but it's climbing. It's going to climb. So the country has had 2,752,000 cases, of which Western Australia contributed 1,748. So it's really, you know, our COVID experience has been completely different to the eastern states. Absolutely 100% different. Because we've had so few cases, so little sickness, such a normal society. We haven't had the long lockdowns. We've had kids going to school. We had people in work. It's been completely different. But as I said before, that's all about to change. And we can't control that it's going to change. But what we can do is ameliorate it. And so everything we're doing around borders, around these rules are about ameliorating the impact as much as we possibly can, in order to save lives and save people's jobs.
How much of what's been going on in terms of the school system made this change today? Because clearly, you know, domino effects happening in terms of schools and the hundreds of children that are now locked in their houses with their parents mostly.
The changes today are based on health advice, and it's the growing number of cases, and in fact we have people coming in who are subject to quarantine, isolation and testing, but we do know, human nature as it is, there will be some leakage out of that. So that's what the changes today are about. Look, it's been unpleasant for some parents, I know that. I think we've had 8 schools impacted. We've had a number of classes at home and a number of teachers at home. One school has decided to have teaching in the school environment suspended and learning from home, online learning from home. Just make the point, and I compare this to you, we've had 8 schools impacted with a number of classes impacted. One school out of 1,100 close. Queensland's had 1,700 schools close for 2 weeks. We've had 1. South Australia has had half its school population stay at home. Victoria and New South Wales have had thousands of cases in their schools amongst their teachers. Over the course of the last 2 years, and Victoria's been going through this for 2 years in effect, they've had months and months and months of no kids at school. So again, our experience has been very, very different to the other states, and it still is. And this is the reason why we've adopted the cautious approach we have. We want to keep that going as much as we can. But, you know, we're going to see more cases and more disruption. But as we get higher vaccination levels, both of adults and children, the disruption will be reduced.
Can you just clarify what the situation is for people in 2 weeks of isolation right now, like those school students, for example, with teachers?
Once they've done 7 days of isolation, provided they have a negative test, they'll be free to go.
And can you also just clarify what happens in the school now if a student or a teacher tests positive? Do they go into isolation for 7 days?
Yes.
So they don't keep attending school as long
No.
as they're asymptomatic?
If they're positive, no.
No, sorry, the contacts, the other
Sorry,
people in the class.
So referring to the very high critical.
Yeah, so no, so the Minister was referring to what was called very high caseloads, and that's the same as the critical worker definition, which don't kick in because we're not at very high caseloads. Today is about high caseloads. So both for schools and the broader community, they're roughly aligned. It's high caseloads. So if you're positive, you quarantine, and you're subject to making sure that you're better before such time as you come out. So that's the rules for positives. But I outlined the rest of it a couple of weeks ago, what the rules would be.
It's likely that we'll keep seeing pretty major disruptions to schools if that's the case, right? If you have to quarantine for 7 days, if somebody in your class tests positive, that still takes on potentially hundreds of students for a week.
No,
Back to school, someone else can test positive and they're off to another one.
I outlined to you what the rules were for schools before, but I'll repeat them. So the rules around schools are these. So it depends upon close contact definitions. So a close contact is someone who is in face-to-face contact for 15 minutes or more with an infectious person where a mask was not worn by the exposed person or the person with COVID-19, or interaction for more than 2 hours in a small indoor space or in a classroom with an infectious person where a mask was not worn by the exposed person or the person with COVID-19. Now, there's 2 categories of people, and it's obviously very limited. In those circumstances, that people caught by that, students or staff caught by that, there would then be a requirement to quarantine and be tested.
Are international students going to be able to, with the changes to international arrivals and the camp increase, are they going to be able to come straight into Australia?
No, I think we outlined last week what the rules around international students would be. So if they're in Australia before February 5, they'll be able to come in. So our cap for international arrivals has doubled to 530. So obviously if any come in under that cap, well then they can come in. But that's the existing arrangement.
Once you get to February 21st, then if you're letting in, if the country's letting in all sorts of people, I'm sure they'll just be able to come straight in.
I couldn't hear you.
If we get to, the Commonwealth's Feb, was it later this month, they're letting in all sorts of travellers, then surely they'll just be able to come to WA.
No, because they have to meet the exemption criteria. So we announced the exemption criteria. So as you know, we keep a border in place. In order for people to cross the border, they have to be one of the compassionate cases, specialist worker, those sorts of people. And then they are required from Wednesday morning to do 7 days quarantine and be tested, subject to a testing regime. So to come across from the east, you still have to do that. It's just the amount.
Flying in straight into Perth, though, like internationally straight into Perth.
As I said, there's a 530 cap on that.
Where are you at with the international border? I mean, given that the country's going to be open and will still be closed, how do you feel about that?
Well, as I've said to you many times, if we just open the borders, we'll see thousands of cases. If we open the borders without restriction, we'll see thousands of cases.
That's what we're ready for, haven't we?
So as I said to you earlier, we are now at 45% third dose, 44.4% third dose. It climbs by 1 to 2% a day. As we get that third dose up, we're going to save lives. Queensland on Friday had 21 people die. 2 of them had third doses. 19 had not had a third dose. So in other words, by having the third dose, in place for more and more people, we're going to save hundreds of lives, and that's our intention here. Now, the other point you need to know, and this is what's occurred over East, is having lots of cases, that is actually not good for the economy. It's actually not good for the economy. I saw a story in the Sydney Telegraph the other day. Basically, Sydney is completely shut down by self-imposed lockdowns. Front page, bunch of stories inside, because it's not good for the economy. So if we can get the third dose up, if we can have close contact rules and the like that moderate the peak in the virus, we're actually going to have better economic and jobs outcomes than otherwise. If you see thousands of cases overnight and you have a massive peak, you're going to make the situation worse. So this all just requires as careful and cautious approach as we can, and the best calibration of all measures based upon the experience of watching the East and watching what happens internationally, to come up with, again, a uniquely West Australian response.
What's our rat stock at the moment?
I think it's 7 million or something. 7 million. Yeah.
Just returning to schools, the face mask wearing, that's not being extended to year 3s and above at this stage?
It will be. So it's not yet, but it will be. We're getting additional supplies. Parents can, kids can voluntarily wear them if they wish to, but it will be put in place at some point in the future.
And do you envision a rat screening or surveillance type program in schools at some point in the future, like we've seen in Queensland? New South Wales.
So New South Wales and Victoria have it. Queensland didn't do it. They closed schools for 2 weeks, all their schools, and South Australia didn't want to do it either. So, look, New South Wales and Victoria, what are they? They were tracking along at 20, 30, 40,000 cases a day each. So they put in place the surveillance rat scheme. We have not done that because we have not needed to do that. We'll watch what happens over there and see how the system goes, but we're obviously not at anywhere near those levels at this point in time.
Along lines and wait times at testing clinics today with interstate arrivals doing their 48-hour test. Some are worried that this is only increasing their risk of catching COVID. I understand we will be moving to rat tests eventually, but in the meantime, is there anything being done to reduce that risk, or will more testing clinics be open with the increase of interstate arrivals?
Well, we have drive-through clinics where people don't have to get out of their cars, and there's a range of clinics and opportunities there. So we're encouraging PCR testing at this point in time, but the opportunity is there as of midnight tonight to also have a rat test. So those are the two opportunities that are there for people. You might recall, over in the New South Wales or Victoria, they've had lines at these clinics for months and months and months, and I think they've almost moved totally to rat tests. But PCR tests are more accurate, so we'll persist with the system for as long as we can, but the alternative of rat testing is there as well.
Premier, I'll ask this, I don't know. You probably don't know about this, but the Commissioner might have heard about it. There's reports online about multiple trucks on fire at Border Town, waiting for COVID checks.
In South Australia?
Western Australia, South Australia border.
A border town or on the border?
Well, they're waiting for COVID testing. It's been reported by the Daily Mail. Several trucks erupt in flames at border between Western Australia and South Australia. Commissioner, anything?
I don't know.
There's photos.
Oh, well, the Commissioner, you're finished with me? I'll get the Commissioner.
Sorry, just under these new 7-day ones, just for the sake of it, does that mean Matt Hebden can see his baby be born?
If he hits 7 days and he's negative, yes. But I think we're going to organise, like we do for many of these cases, for him to participate wearing the appropriate PPE in any event. Thanks very much.
So just on the bushfires, can I ask, I believe a call was put out to New South Wales and Queensland for assistance. Was that call put out countrywide?
I don't know the answer to your question, but I'm appreciative that firefighters have come in from elsewhere. So what happens when there's fires around Australia is each state helps the other. So we've sent firefighters over East many times, and the large aerial tankers are shared between the states. So the system, I reckon, is absolutely terrific of the states helping each other. Thank you. Commissioner?
This might show how quick my people are. I've just asked the question. I haven't been briefed,
okay.
So I've no information at the moment. But
no, I didn't mean to put you on the spot with it. It's just that you people were here, so you were here so we could ask it. Fines, is that a good idea for people with rat tests who don't hand them in? Or is it just an honour system, really?
Well, look, we've had great cooperation from the West Australian community. Throughout the last 2 years, the Emergency Management Directions and the Public Health Act directions all have penalties attached to them. If you don't have penalties attached to them, some people will break the rules. So we've been using our discretion as much as possible, e.g. mask wearing, but in this situation, yes, it does require people to honour the commitment to keep the law. If they fail to do that, or they want to try and game the system, then as we've proven time and time again, we will charge if people are blatantly and fraudulently breaking the law. So look, this is quite normal in human behaviour. That I'm saying is people will comply, but there will be a very small percentage who will probably try and game the system. So you do that at risk of either a $1,000 infringement or a $50,000 fine, or we can simply charge them and put them straight to court.
Get the Chief Health Officer?
Yep, I've just got some information. The truck situation appears to be under control, although the truck's on fire, but possibly overheated brakes is one of the early information, so we have no information of any certainty about the truck fires. But it doesn't appear to be anything sinister at this stage.
Dr. Robertson, can you explain a bit more as to why 31 cases is a high caseload, and how much was our close contact, the contact tracing system we're doing at the moment, was it just not going to be able to deal with new cases in the coming days?
So there's a number of considerations here. So what we've been doing is watching very closely what's been happening with the caseloads, and I think early on in the press interview, the numbers were read out, and if you look at those numbers, you'll see that we are doubling. And the thing is that nobody notices us doubling at the early stages. 8 to 16, nobody notices. But if you look at the numbers, unfortunately, the majority, more and more of those cases are locally acquired. More and more of those cases are unlinked. So we would anticipate within the next few days that our numbers will start to doubling, and you will notice when we go up from 36 to 72 to 144. So we are looking at that and preemptively putting those measures in, because we're expecting that we will get those rise in coming days, and obviously putting these measures in to actually manage them and to do that safely is part of the thinking.
You're not talking about daily doubling, are you? You're talking about weekly doubling, or because day to day they haven't doubled.
No, I'm not saying, but you will look at it. Will the doubling rate is, yes, it's about weekly at the moment, but it will continue. It will increase in speed as more and more people become infected, and you will see the doubling rate of this disease is usually at its peak around every 3 days. We're not there yet. We're still early on, but it will start to double from here. The second part of the question was whether our contact tracers can manage it. Yes, they can, but the numbers will get to a level where they're not going to be able to track down every exposure site, that they're not going to be able to identify every interaction between people. These measures will actually enable them to actually do that safely by identifying the really high-risk contacts and then providing appropriate isolation and quarantine.
And when we're on that kind of exponential growth curve, which it sounds like will be very soon, 100 to 200 new cases a day, is there any utility to the whole border at that point in time, or can we bring it down, given that we've already got hundreds of cases?
So obviously, we're also, the other thing you'll probably notice is that we're also getting quite a few cases that are coming in from interstate, a small number from overseas. So, and obviously we're looking at what's happening. We've had 6,000 or so people, I think 10,000 over the weekend. One of the things we will be looking closely at is how many cases, all of those people are required to get tested. We'll be looking at how many cases we pick up from those people. Now, obviously, we're less concerned because they'll be in self-quarantine, but that would add to our figures, and it would certainly add to our community spread if they didn't go into self-quarantine. But we will continue to look at that, and obviously I'll continue to provide advice to government as the situation evolves.
Are you buoyed by the fact that is there still only one person in hospital, or has that person been discharged now?
There is one person in hospital at the moment, but it's not probably the same person. We've had a couple of people come in and leave hospital, and that's not unusual with this disease. The length of stay in hospital tends to be shorter. It tends to be 4 days compared to 8 days. So we've seen a couple of people come and go in hospital. We've got one in at present.
So to see one person in hospital at this point in time, how do you feel about that? That's obviously fairly encouraging, isn't it?
Look, I think it's very encouraging. I think the population has done the right thing. Very few other jurisdictions anywhere in the world have actually gone, have been at this phase with the population, nearly 93% double vaccinated, 45% over 18 triple vaccinated is a very impressive place to start from, and that will, I think, as this plays out, will be to our benefit.
Are we still tracking on that? I know you talked about March 2 being 75% triple jabbed. Is that still an interesting time for you in terms of when things start to wane for those frontline workers that had their third jab in December?
So I think we're pretty much on track for, I think I predicted roughly at that time around 45% from March 5th. I think we're pretty almost exactly on that date. So I think people are doing the right thing. We're seeing, if anything, people are now, more than, we were averaging that on about 1.2, 1.4%. People are getting boosted in WA. They, I think, see the real benefits of this.
I think your advice was 75% by March 5th, so you just meant like sort of 40%.
No, I said, well, the 45% was for the February 5th date, sorry.
Given the current case environment, do you see any barrier to AFL teams being able to travel freely in and out of Western Australia once the AFL season starts?
So we're obviously continuing to work very closely with the various football codes, various other sporting codes, and looking at arrangements for them over the coming weeks. But that we're still in discussion with them.
Do you think that we will be able to have a more standard home and away type season rather than the hub arrangement that we've had to have in the past?
Look, we are looking at different options. One of them is a fly-in, fly-out option, which would be a quarantine type option, but we'd need to look at how that could be done safely going forward.
What are you observing in other states in terms of daily cases and hospitalisations? Have they passed their peak, and how much confidence does that give you?
Look, I think most of the states are now feel that they're past their peak of cases, and they increasingly feel they're actually past the peak of their hospitalisations. Unfortunately, the problem with this disease is if you get very seriously ill, you could be in hospital for weeks, and we're still seeing, unfortunately, the deaths continue to occur. Some of those were actually still probably related to Delta, because what we saw in the eastern coast was a bit of a mix of Delta and Omicron, particularly in New South Wales, Victoria, Queensland. So some are probably related to that, but they feel they're on the way down. But there is ongoing concern that they could have further waves going forward.
And what's your thinking around not implementing more restrictions now as an interim measure until we get to that 85% or 90% third dose vaccination? Why sort of allow the spread to continue unabated locally while we head towards higher rates of third dose vaccination?
Well, we're not allowing it to continue unabated. We've got masks and other public health and social measures already in place. We'll continue to review those public health and social measures, and as the numbers increase, we will make further recommendations going forward. At the moment, we feel that the current measures that we have in place are appropriate, and on top of our, I think, very effective, contact tracing and testing at the moment, then we're comfortable that we are managing to suppress. And I think the fact that we're not doubling every 3 days would suggest that we are keeping it under control, that we're isolating people, we're quarantining people, so we're not getting rapid spread through the community.
You think we're at that point now where we kind of might get that doubling over a couple of days? So I mean, is it a likelihood we come back here in a week's time and we're getting 100 cases, and then we get public health measures, new public health measures?
All of those factors, would be considered in our advice back to government as to what the next step should be.
Dr. Robinson, I'm sure you turned your mind to the AFL. Will round one be normal and out of a bubble?
Look,
What date's round one?
I don't know.
We will work with the AFL on whenever round one is. I must admit I don't follow it that closely.
But things are easing considerably in terms of people being able to come back under more compassionate grounds, going to a much lesser period of quarantine. Public health measures obviously going to come in, but do you foresee the AFL as being a lot better than it was perhaps last season?
Look, I think the last season, we had different. We basically were facing different concerns. We obviously had a different position from our vaccination rates. We had to manage them carefully, and we did that successfully, and we managed to get through that year, and obviously managed to have a grand final here. So. Those measures worked. Obviously, this year is different again with Omicron, and we will work through and look at the best options for the WA population.
So you were saying earlier we've got a bit fumbled around with the March, February anticipated target. So you said last month 35% by 5th of February. So obviously we're at the 44% now. So are you anticipating that 80 to 90 will hit much earlier, and they'll sort of be in March, and just one other part to that?
All we're saying is that currently we're at 45%. We are going up at about between 1.5% to 2% a day. So we would hope to, by the 5th of March, for example, be up, by another 35-40%. That's just, if people continue to get the boosters, and we're strongly encouraging them to get those boosters.
And what, I think on the 20th, you said within 4 weeks there would be a review around a new opening date. So is that going to be at the end of that 4-week period, or are you looking at having something earlier next week, or when can we sort of anticipate discussions happening around that?
So in the discussion, we are constantly reviewing the situation. We're constantly providing advice to government. It's not a sort of a one-off thing. It really is very dependent on our case numbers. It's really dependent on our vaccination rates, on our booster rates. It's dependent on all of those kind of factors, and we will, and we continue to provide advice to government. And obviously, one of the things, obviously the changes today were based on advice we've provided to government.
Is that the trigger for the whole border though? Once we hit 80% or 90% third dose coverage, you would be satisfied for the border to come down?
Again, we will look at all of the factors that are involved. It's not just necessarily on the, that's one of the factors that would be considered, but not necessarily the only factor.
For sure there's a carrot for the population having this high take-up of vaccine, and we get into sort of early March or mid-March that we're having high third dose rates. At the end of March, you've said that you start getting that waning efficacy. So being that still 3 months out from winter, surely your preference is going to be to open up in winter and before winter, and having a highly populated third dose population.
So we are looking at all of the options. There are a number of factors. I'm not going to say on a particular dose or on a particular percentage of thing. It really does depend. It'll depend on our caseload. What is our caseload going to be like in two weeks' time? What is our?
Sorry, you forgot to ask the Commissioner something.
When you finish, Andy, sorry.
Yeah. What is our caseload in 2 weeks' time? How many? What impact is it having on our society? What is our number of people who are fully vaccinated or had booster doses? All of those are considerations.
Are you happy with how the rollout's gone in prisons lately?
So we've provided rollouts to the prisons, you know, on a regular basis, and we have had teams out there at different times for all of our prisons. But you know, unlike the prison guards, the prisoners aren't mandated, and you know they can elect to be vaccinated or not. And we continue to work with the Corrections Service to make sure that they get them the best coverage. We would love to get them all fully vaccinated, but that's still a personal choice.
Quick question to the Commissioner, very quickly. One each. Commissioner, the other day a police officer walked into a Catholic church and stopped mass to check masks. How did you feel about that?
It wasn't exactly like that. I'll explain the chronology of it. We had about 30-odd parishioners in a Glendalough Catholic church. Two of the parishioners were there wearing their masks. They noticed the rest of the congregation basically weren't. They have been vaccinated. They are elderly. They were very concerned that they might be exposed to COVID. They asked the priest if he could ask the rest of the parishioners to wear their masks, and the priest declined to do so. So they rang the police. The police received the call and said, look, we've got a complaint here because no one's complying with the mask wearing, and we feel that we're at risk. The Wembley police attended and they spoke to the priest. They asked the priest who was officiating in a discreet way outside of the hearing of the parishioners at the side and said, can you please ask your congregation to wear the mask? The priest declined and said, well, better if it comes from you. So the brief I got, and I followed this quite closely, they went and spoke to the congregation and said, look, some people in the church here are very concerned because, one, you should be wearing masks, two, they want to worship here and they don't want to be exposed to COVID, and besides, it's the law. It was done very discreetly, politely. There was no argument. Everyone, bar about two people, declined to put a mask on. And when the police officer said, well, everyone else has put them on, why haven't you? They said, we've got a medical exemption. I've seen the social media post, which appears like police are demanding, and there's been a whole lot of misinformation I've already received that police are being accused of acting like the 1930s in another European country. Quite outrageous comments. It was done with discretion. The person who produced their medical exemption did have one, and so the police simply viewed that and left. Everything was all orderly, but the way it's all portrayed on social media is that police are actively going in there and demanding to see mask wearing. They're responding to a complaint, and I'll just close off my comment to say this. Police cannot enforce the law simply based on an ideology. We're doing this to protect the public, and I'm sure that I would get questions from the media and other people who said, if the police refused to respond to a complaint from parishioners who are elderly, done the right thing, obeying the law, and we said, well, we don't want to do this because it's too sensitive. So I fully back the Wembley police who attended that. I believe they did the right thing by not only adhering to the law, but they did it sensitively, with discretion, and that's what churches aren't exempt from this. And yes, it is delicate, but it was done in a very sensitive way.
Commissioner, the 23-year-old man who was shot last night down in Warnborough died in hospital.
Last I heard was that he was critical, so I haven't received information about that. And just so obviously we're investigating that. Just in closing, the advice I've got about the truck is that it's on the South Australian side of the border. There's nothing at this stage that it's suspicious. There's no injuries, but clearly the truck's been destroyed.
Thank you.
Okay, thank you.